If you're over 45 in America, there's a 95% chance your doctor hasn't told you these 5 critical colonoscopy secrets that could save your life and thousands of dollars. I'm about to reveal what 30 million Americans wish they knew before their procedure, including the scheduling trick that increases polyp detection by 15%, the PrEP alternative that eliminates 90% of the misery, the sedation option that lets you drive home immediately, the insurance loophole that creates surprise $3,000 bills, and the recovery secret that prevents dangerous complications. So grab a pen because the next 15 minutes will change everything about your colonoscopy experience. Secret number 1, the scheduling strategy that saves lives. Here's what your doctor never mentioned. The day you schedule your colonoscopy dramatically affects your results because Monday appointments have 15% lower polyp detection rates due to weekend equipment downtime and staff getting back into rhythm. Friday procedures are rushed with weekend-focused staff and inexperienced technicians, but Tuesday through Thursday morning appointments hit the sweet spot. With calibrated equipment, alert doctors, and peak performance staff, plus scheduling during the second or third week of the month, avoids month-end quota pressure that can rush your procedure. I've seen this timing difference literally mean the difference between catching early-stage cancer and missing it entirely. So when your doctor's office calls to schedule, don't just take the first available slot, specifically request Tuesday through Thursday mornings during mid-month weeks. Secret number 2. The PrEP revolution. Your doctor forgot to mention. That gallon of horrible Golitelli your doctor prescribed isn't your only option. There are now 4 different PrEP methods, but most doctors default to the old-school torture because that's what they learned 20 years ago when you could be using Sutab pills, just 12 tablets, Clenpic liquid, only 10 ounces, or Prepopic powder instead of choking down a gallon of salty nastiness. And here's the game-changing timing secret. Instead of chugging your PrEP solution quickly, which causes violent nausea and cramping that sends thousands to the ER yearly, sip it slowly over 2 hours while staying warm and walking around every 15 minutes, which prevents the misery and actually cleans your colon more effectively than rushing through it. Plus, you can request the split dose method where you drink half the night before and half the morning of your procedure, which is proven more effective for cleaning, but many doctors forget to offer it. One patient told me she canceled 3 colonoscopies due to PrEP sickness until she discovered these alternatives and said the experience became easier than preparing for vacation. Secret number 3, the sedation. Secret that could save you hours and hundreds. Most Americans assume they must be completely unconscious for colonoscopy, but you actually have 4 sedation levels. No sedation, which 30% of worldwide procedures use with immediate discharge. Minimal sedation with light medication where you're awake but relaxed and can drive home within an hour. Moderate sedation, which is the American default requiring someone to drive you home. Or deep sedation with an anesthesiologist costing the most with longest recovery. Countries like the UK and Australia prefer minimal sedation because patients can watch their procedure on the screen, ask real-time questions, get immediate results, and avoid the post-sedation fog that makes you forget important medical information. So if you choose lighter sedation, request to watch the monitor because seeing your own colon is fascinating, and you'll spot polyps simultaneously with your doctor while getting answers to questions instead of trying to remember everything through sedation haze. Secret number 4, the insurance trap that creates $3,000 surprise bills. Here's the massive loophole catching 40% of patients. When you schedule a screening colonoscopy, insurance covers it 100% as preventive care with no copay or deductible. But if your doctor finds and removes even a tiny polyp, many insurers automatically reclassify your entire procedure as diagnostic instead of preventive, suddenly hitting you with deductibles and co-insurance running thousands of dollars that you discover weeks later when the bill arrives. I've seen bills jump from $0 to over $3,000 for removing a single small polyp because insurance logic says, we found something so it wasn't really preventive. So protect yourself by calling your insurance company directly before your procedure, asking specifically, if polyps are found and removed during my screening colonoscopy, will I owe anything? And get that answer documented. Ask your doctor's billing office about financial hardship policies that can reduce surprise bills, and consider cash payment if uninsured or high deductible, since many facilities offer 50 to 70% cash discounts to avoid insurance paperwork. One viewer saved $2,400 paying cash up front instead of using insurance. Secret number 5. The recovery protocol that prevents dangerous complications. Your doctor sends you home saying, "Take it easy and call if problems." But there's critical information they're not sharing. If you had sedation, your judgment and reflexes remain impaired 24 hours even though you feel fine, so don't sign documents, make major decisions, or operate any machinery including kitchen appliances. Restart your diet gradually with clear liquids, then bland foods like toast and bananas instead of jumping into heavy meals. Avoid alcohol. 48 hours as it interacts with residual medications. Expect normal mild bloating and gas for 24 to 48 hours from procedure air plus light spotting if polyps were removed. But go straight to emergency for severe worsening abdominal pain, fever over 101 degrees, significant bleeding, or persistent vomiting, which could indicate perforation or serious complications. Most colonoscopy complications appear within 48 hours, so keep your doctor's emergency contact handy and don't hesitate to call if something feels wrong. Plus, request copies of your procedure photos immediately because every colonoscopy includes colon photographs that can save you from repeat procedures if you change doctors or need specialist referrals. Your action plan: taking control of your colonoscopy experience. Now you know more about colonoscopy than 95% of people walking into their doctor's office. Assess your risk level with family history requiring earlier screening and more frequent monitoring, while average risk gives you more options including annual FIT stool tests. Choose your strategy with high-risk patients going straight to experienced gastroenterologists, while average risk can start with stool tests, switching to colonoscopy at 50 or if positive. And if choosing colonoscopy, remember to schedule Tuesday-Thursday mornings mid-month. Ask about low-volume prep options and split dosing. Discuss sedation levels matching your comfort and schedule needs. Confirm insurance coverage for both screening and potential polyp removal. Request procedure photos and pathology reports. Follow prep instructions exactly, since this causes most failures. Stay hydrated and warm during prep while moving regularly. Arrange transportation if using sedation. Clear 48 hours post-procedure. Get results before leaving. Schedule appropriate follow-up, and keep all records. Remember, this is your health and your money, so you have every right to ask questions, request alternatives, and make informed decisions without anyone rushing you into uncomfortable choices. These 5 secrets have helped thousands save money, reduce anxiety, and get better colonoscopy results. Whether you use all or just some, you're now ahead of 95% of patients. So if this helped you, please thumbs up and share with anyone facing colonoscopy, because your share could literally save someone's life or thousands of dollars. Subscribe and hit notifications for more insider medical information helping you navigate our complex healthcare system. Download my complete colonoscopy success checklist from the description link as a printable guide for your doctor appointment. And drop a comment sharing which secret surprised you most, or your own colonoscopy experience to help others feel confident. Thanks for watching, and remember that knowledge is power, especially regarding your health. And here's a bonus tip for dedicated viewers still watching. If you take blood thinners like warfarin, Plavix, or baby aspirin, coordinate with all your doctors at least 2 weeks before your procedure, because your gastroenterologist wants them stopped to prevent bleeding while your cardiologist worries about stroke risk. And I've seen last-minute cancellations from blood thinner miscommunication, so start these conversations early to avoid that frustration.